What's going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. Today we are going to be discussing arterial blood gases on your NCLEX and nursing school exams like a boss, and we're going to learn how to interpret ABGs. Let's get our nurse on. So let's get down to the nitty-gritty. How do we interpret arterial blood gases? Well, there really is a three-step system. So step one, you're going to determine whether the blood gas is acidic, alkalotic, or neutral. So a pH, the normal pH is between 7.35 to 7.45. A normal PaCO2 is between 35 to 45, and a normal HCO3, which is our bicarb, is 21 to 28. So we base specifically if it's acidotic or alkalotic or neutral based on those values. Step two, we're going to determine the source. Is it a respiratory source? Is the CO2 out of whack? Is it a metabolic source? Is the HCO3 out of whack? So depending on which one of our values is abnormal will help us determine whether it is a respiratory or metabolic reason. And lastly, step three, is the patient compensating? So are they partially compensated or fully compensated? And we're going to be discussing that a little bit later. So we begin with step one. We're going to take a deeper dive into what that looks like. So in step one, it's how we determine whether we're acidotic, alkalotic, or neutral. So I included this nice little table down below for you to really see specifically how we determine these values. So when we look at our pH, we know that normal is 7.35 to 7.45. Well, we know when we're in an acidotic state, our pH is going to go low. It's going to decrease. So if we have a pH less than 7.35, we know we're in an acidotic state. Whereas in the opposite end of the spectrum, if it's above 7.45, we've got less acid, we've got more base, it's going to cause our pH to increase, making it greater than 7.45, we're going to be in an alkalotic state. Moving on to our PaCO2, this one looks a little bit weird, but hang with me. So we know that normal is 35 to 45, but we know that our PaCO2 is an acid. That's the acid part of our arterial blood gas. So if we've got more acids greater than 45, we know we're in an acidotic state. Whereas if we have less acids, less than 35, we're going to be in an alkalotic state. So more acid, higher acidity, less acids, more alkaline. That's how we determine our PaCO2. And lastly, our HCO3. Normal is between 21 to 28. We know that this is a base. It's going to be more alkalotic. So the less base we have, less than 21, we're going to be more in an acidotic state because we don't have enough base to buffer that system that we talked about before. Whereas if we've got a HCO3 higher than 28, that means we have more base in our arterial blood gas, we're going to be more alkalotic. So step two, how do we determine the source, right? So it's either going to be a respiratory component or it's going to be a metabolic component. And we determine that based on which arterial blood gas values is what I like to say out of whack. So when it comes to our respiratory component, we know that the PaCO2 component of our ABG is going to be acidotic. So the higher we have, the more acid we have, greater than 45, we know we're going to be in an acidotic state. Whereas the less acid we have, less than 35, we're going to be in an alkalotic state. And we either retain or lose CO2 with various breathing patterns dependent on what the arterial blood gas is showing. If we have a high acid state, we're going to breathe faster. The body is going to try to regulate that by getting all of that acid out of our system. Whereas if we don't have enough acid and we're in an alkalotic state, we're going to breathe a little bit slower and our respiratory system might be a little depressed. So the body can regulate retaining that CO2, retaining that acid to balance out the system. So let's talk about the metabolic component of our arterial blood gases, and we determine that based on our HCO3, our bicarb. So HCO3 is our base. We know that if we don't have enough base, if it's less than 21, it's low, we're going to be more acidotic because we don't have enough base to even out that acid-base system. Whereas if we've got too much base, if it's greater than 28, we're going to be in a more alkalotic state. We've got too much base, not enough acid, we're going to be alkaline. Some examples of excess or loss of acids when it comes to HCO3 could be GI loss, when it comes to vomiting, ketoacidosis. You're going to see this a lot in your diabetic ketoacidosis patients. And if you haven't watched that video yet, it's really a great video and helps you kind of give you an overall picture of what these diabetic ketoacidosis patients look like. So make sure that you check that out up here in the corner. When it comes to our kidneys, again, our kidneys are major contributors when it comes to loss or retention of our bases. We talked about that before. That is our metabolic component. And then lastly, you're going to see lactic acid. That's going to be a huge determination, specifically when it comes to the metabolic component of our arterial blood gases. So let's begin by interpreting our first arterial blood gas. You ready? All right, so let's get started. So our first example is our pH is 7.5, our PaCO2 is 30, and our HCO3 is 21. So let's begin by always looking at our pH. So our pH is 7.5. Well, we know that normal is between 7.35 to 7.45. So we know that this pH is high. It's greater than 7.45. So we know we're in an alkaline state, right? Next, we look at our PaCO2. It is 30. So we know that normal is 35 to 45. Well, this is a little low, right? This is less than 35. And as we know, the less acid we have, the more alkalotic we are. So we are in an alkaline state when it comes to the respiratory component of our ABG. Lastly, looking at our HCO3, we've got 21. Well, we know that our normal is 21 to 28, so this is a neutral value. So we know that our HCO3 is neutral, so we have to take a look at our pH and our CO2. Well, we know it's alkaline because they're both in the alkaline components of our table down below. So we know we are in an alkalosis. But specifically, what is it? Well, we know that our PaCO2 matches our pH, right? They're both alkaline. So when they match our pH, we know that this is a respiratory component. So we have respiratory alkalosis. So let's move on to example 2. So in example 2, we have a pH of 7.30, a PaCO2 of 35, and an HCO3 of 18. So again, we begin by always looking at our pH. Is it high or is it low? Well, normal is 7.35 to 7.45, so we know that it is low. So we're going to be in an acidotic state per our pH. We've got more acid, our pH decreases, right? Looking at our PaCO2, 35. So we know that normal is 35 to 45. So what does that mean? Our PaCO2 is neutral. And lastly, looking at our HCO3, it is 18. Well, normal is 21 to 28. So we know that the number is low. It's less than 21. So we've got more acid in our system. So we know based on our values that we have an acidosis taking place. And then we look at our PaCO2 and our HCO3. Which one's out of whack, right? Well, it's our HCO3. So we know that this is a metabolic component because our HCO3, which is our base, is buffered by our kidneys, making it a metabolic component and not a lung component like our PaCO2. So in this example, we have a metabolic acidosis. So moving on to example 3, we have a pH of 7.25, a PaCO2 of 60, and a bicarb HCO3 of 21. So again, we begin by looking at our pH. So our pH is 7.25. Well, we know normal is 7.35 to 7.45. So this number is low, right? It's less than 7.35, making it a acidosis. Right? We got more acid. We have more acid, our pH decreases. So we have a PaCO2 of 60. Well, we know that normal is 35 to 45. 60 is a little high, right? That means we've got more acid in our system. It's greater than 45. So again, our PaCO2 is showing an acidotic state. Lastly, our HCO3, 21. Well, normal is 21 to 28, so we know that this is neutral. So based on what our ABGs are showing us, we know that our patient is in an acidotic state. And then we go and move on to, is our PaCO2 out of whack or is our HCO3 out of whack? So based on these values, our HCO3 is neutral, right? So it's our PaCO2. So we know that this is a respiratory issue. So we ultimately have a respiratory acidosis. You're going to see a lot of this with our COPD patients. And when it comes to our COPD patients, this might actually be their normal. So we're not going to make huge adjustments to this particular arterial blood gas if this is what their baseline is. So dependent on your patient condition and comorbidities, really will influence what the treatment is going to look like. But at least we know this particular blood gas, if we were to get this from the respiratory therapist or the nurse, depending on where you're at, some nurses also get arterial blood gases, we would know that this patient is in a respiratory acidosis. And moving on to our last example, example number 4, we have a pH of 7.5, a PaCO2 of 45, and an HCO3, which is our bicarb, of 30. So like we always do, we start with our pH. Well, our normal pH is 7.35 to 7.45. In this situation, it's a little high, right? It is greater than 7.45. So we know that we are in an alkalotic state based on our pH. Now we got to figure out, is our PaCO2 out of whack or is our bicarb or HCO3 out of whack? So we've got a PaCO2 of 45. Well, normal is 35 to 45 when it comes to our PaCO2, so we know that this value is neutral. When it comes to our bicarb, we've got a bicarb of 30, so we know that normal is between 21 to 28, so this is high, right? So we've got more base in our system than acid. So we're going to be in an alkalotic state. Well, based on what our values are showing us, we know that we are in an alkalosis. But particularly, what alkalosis is it? Well, that we go back to our PaCO2 and our bicarb, and which one's out of whack, right? Our HCO3 is out of whack, and our HCO3 is showing alkalosis. It's agreeing with our pH. So we know that this is a metabolic component, or I should say a metabolic cause. So this particular blood gas is metabolic alkalosis. So now that we know how to interpret arterial blood gases, we really need to start looking at compensation. Well, what is up with compensation? Well, really, it's what's going on with our buffer systems, right? So carbonic acid bicarbonate buffer systems, like we talked about before, and our acid-base balance video, if you haven't checked it out, make sure you go back and check it out. It goes into full detail about this, but we know that it's the primary buffer system of our body. It helps maintain our pH of 7.4 with a ratio of 20 parts bicarbonate, that's our HCO3, our base, to 1 part carbonic acid. And carbonic acid is controlled by the excretion of carbon dioxide by the lungs. Remember, a byproduct of carbonic acid is our carbon dioxide and our water. And ultimately, it is exhaled when we breathe with our lungs. Our carbon dioxide is exhaled every time we breathe out. Bicarbonate is controlled by the kidneys. It either retains or it excretes bicarbonate in response to what's happening inside the body with acid-base balance. We also have our potassium buffer system, which we talked about before. It's huge. The body exchanges potassium with hydrogen ions into the cell, or by pushing, well, let's think about it. So if we have a high acidity, we are going to intake the hydrogen ions to try to buffer that, right? And it's going to push potassium out. So we're going to have a higher potassium in our serum system of our body. Whereas if we're in a more basic state, what the body is going to do is it's going to take hydrogen ions from inside the cell And what does the potassium to do? It's going to go inside the cell. So they kind of have like an inverse relationship when it comes to the acid-base system. So if we're pulling acid out because we're alkalotic, we're going to be pushing potassium in, making our serum potassium levels low. We're going to be hypokalemic. So our potassium buffer system also plays a huge role when it comes to the acidity of our system. We have our lungs. Our lungs are very quick when it comes to compensation, like we talked about before. It happens within minutes, 10 to 30 minutes, for that puppy to really kick in and help balance out that system. That is how the body compensates with the lungs. That's the PaCO2 component of our arterial blood gases. And lastly, we have our kidneys. We know compensation for this is going to take days or weeks depending on what specifically is happening with our patients. So it's going to be a much slower process. Metabolic, very slow, right? And that's going to be the bicarb portion of our arterial blood gases. So lungs are quick. It's going to make quick changes just like that. Whereas our body, when it comes to the metabolic component, is going to be very slow. It's going to take a lot of time for either sodium or buffer systems within the tubules of our kidneys to excrete specifically what is happening with our acid-base imbalances. So how do we determine if our body is compensating? So we determine this by our CO2, which is our carbon dioxide, and our HCO3, which is our bicarbonate. They're going to be abnormal and usually opposite of each other, right? So our CO2 is going to be alkalotic and our HCO3 is going to be acidotic and vice versa. And then we also can break it down even further. So partially compensated arterial blood gases, the pH is still going to be abnormal. So the metabolic and respiratory system is going to try to fix itself, but usually in the beginning of that pH is going to be abnormal. So when we have an abnormal pH, but our carbon dioxide and our bicarb are opposite of each other, trying to fix each other, then we have a partially compensated arterial blood gas. When it comes to full compensation, that's fully compensated, we're going to have a pH that is normal. So while those two systems are trying to fix each other, the pH has gone back to normal, which is between 7.35 to 7.45. That makes it a little bit difficult because then you have to determine whether it is a respiratory or metabolic source when it comes to your arterial blood gases. So we're going to do a couple examples of what that looks like and how we make that determination. So let's take a look at our first example. Our first example, we have a pH of 7.3, a PaCO2 of 60, and an HCO3, our bicarb, of 30. So we always begin by looking at our pH. So our pH is 7.3. We know that normal is between 7.35 to 7.45. Well, it's low, right? We're having a more acidotic situation taking place in the body. So we know that's low. It's going to be acid. And what we do know is it is still abnormal, right? It's not within the normal ranges. Next, we take a look at our PaCO2. Well, it's 60, right? That's a little high. It's normal is 35 to 45. Greater than 45 is a more acidotic state. We have more acids inside of our body. And next we take a look at the metabolic component, which is our HCO3, our bicarb. So normal is between 21 to 28, and we know that this is 30, so the body is trying to adjust, right? We have two abnormal arterial blood gas values. So this one is going to be high, and it's going to be alkalotic, right? So now we need to determine, is this acidosis or is this alkalosis? Well, we determine that based on our pH, right? So we know that our pH is an acid. So we've got an acidosis taking place inside of our body. Well, what other acid do we see? Well, we know that our bicarb is alkalotic, so we don't think it's that. So it's going to be a respiratory issue, right? Because our respiratory is agreeing with our pH. So we have a respiratory acidosis taking place, but we need to take it a step further. What's happening with the compensation? We have two abnormal components of our ABG. Our PaCO2 is abnormal and our HCO3 is abnormal. So the system is trying to buffer it to make it normal again, right? But our pH hasn't fully compensated yet because it's still abnormal. And when we have an abnormal pH and two competing components of our arterial blood gas, our respiratory and our metabolic, we are going to call this partially compensated respiratory acidosis. Why? Because our pH is still abnormal, but our respiratory and our metabolic systems are trying to compete to fix one another. So let's move on to example 2. I know that last example was probably a little bit overwhelming, but I promise we're going to do more practice questions in the future. So let's take a look at example 2. We have a pH of 7.45, a PaCO2 of 32, and an HCO3 of 20. Well, where do we begin? We always begin with our pH. Our pH normal is 7.35 to 7.45. So this pH is actually neutral, right? So let's move on and look at our two components. What's out of whack going on here? Our PaCO2 is 32. So we know that that is low. So we're in a alkalotic state, right? Because normal is 35 to 45. Less than 35 is an alkalosis. We don't have enough acid to maintain those normal numbers. Next, we move on to our HCO3. It's 20. So we know that normal is 21 to 28. Less than 20 is more acidic because we don't have enough base, right? So that number is going to be low. And we have a more acidosis component taking place with our metabolic component of our ABGs. So now we have to determine what this is. Well, now this gets a little confusing, right? Because our pH is normal. We have a neutral pH, it's within the normal ranges. So in order for us to figure this out, we have to see what end of the spectrum does our pH fall on. So normal is 7.4, right? So if it's 7.4 and above, 7.4 to 7.45, we're kind of leaning more towards an alkalotic state. Whereas if it's 7.35 to 7.4, we're kind of leaning more towards an acidic state. So in this case, you know, our pH is neutral, but it's leaning more towards an alkalosis. Right? So what agrees with the alkalosis out of our respiratory and metabolic components? Well, that's going to be your PaCO2. Our PaCO2 is 32. It's more alkalotic, which means we have less acids to make it normal. So we've got a respiratory alkalosis taking place. But we've got to go one step further so we know that our pH is actually normal. This is before, it's always pretty much been abnormal, which is what has helped us determine our arterial blood gases. But now we have a normal pH and two competing components of our arterial blood gas. The respiratory and the metabolic components are trying to fix each other, and they have fixed each other enough that has made our pH normal again. So we can determine that based on this arterial blood gas, we have a fully compensated respiratory alkalosis. I hope that this video was helpful in helping pass your arterial blood gas nursing school exams as well as your NCLEX like a boss. If you haven't done so already, make sure that you subscribe here to my YouTube and hit that notification bell so that way you're informed every time I post a new video. You can also follow me on my social media. I am on Facebook and Instagram, and make sure that you check out my website at www.nursecheung.com. There I'm going to have NCLEX style questions, resources, handouts, everything you need to pass those exams like a boss. But until next time, I hope that you're having a wonderful day, and I will see you all again soon. Bye!